I do think there is something. I think many of us probably feel this way about our training programs. And I feel that Johns Hopkins internal medicine residency in particular has some very special qualities that drew me to it in the first place in terms of selecting it as a place to do additional training. One of them is that early independence in terms of taking care of patients was one of the parts of the training program, meaning as an intern or a resident, as an intern, usually you have a resident who's there in the hospital with you helping take care of patients. At Hopkins, the resident is allowed to be at home and the interns are there overnight to do the patient care. And so you have to be comfortable knowing that that's going to be the expectation, for your training program. And so that's a pretty, pretty heady thing when I think about it now with the experience that I have had in medicine, to say we're going to have these people 6 months out of medical school who are, pretty heavily autonomous. But what I learned is that there's always other people around. I learned to phone my friends, to rely on the kindness of others, and to be humble. Like when you don't know things, to find people that can help you figure it out so the patients get what they need done. So I think that was a pretty integral part of my training that also helped inculcate leadership in me in some ways. The other piece of my training was a very high expectation of excellence in patient care. And that should be ubiquitous, I think, in training.